The gentlewoman from Connecticut seek recognition.
Mr. Chairman, I have an amendment at the desk.
The clerk will designate the amendment.
Amendment number 13, printed in Part A of House Report number 114-551, offered by Ms. Esty of Connecticut.
Pursuant to House Resolution 720, the gentlewoman from Connecticut, Ms. Esty, and a member opposed will each control 5 minutes. The chair recognizes the gentlewoman from Connecticut.
Thank you, Mr. Chairman. Mr. Chairman, I rise today in support of my amendment, which would empower the Interagency Task Force to help communities spread awareness about the dangers of drug addiction through consumer education and to help medical providers more effectively and safely address patient pain management. Along with my colleague, Representative Knight, I proudly introduced this amendment that was inspired by bipartisan legislation that I introduced earlier this year with Representatives Knight and Costello, and that was identified as a legislative priority by the bipartisan task force to combat the heroin epidemic that I proudly serve on with so many of my colleagues here in this House. Mr. Chairman, there is not a community in this great country that hasn't been touched by drug addiction. Not one. Addiction knows no bounds. It knows no race, gender, no economic status, no party affiliation. In January, I was honored to have James Wardwell, the Chief of Police in New Britain, Connecticut, join me for the President's State of the Union address. And he came to join me because of his leadership and his concern about the need to address this growing public health crisis. Chief Wardwell and many other first responders, medical professionals, substance abuse counselors, family members, and recovering addicts have worked with me to help craft legislation to address our growing epidemic of prescription drug and heroin addiction. And I am glad that today this House is taking action. Today's legislation is an example of what we in Congress are supposed to be doing. Our job is to work together, Democrats and Republicans, to address the needs of the American people. Whenever I go home to Central and Northwest Connecticut, at community forums in Torrington, at Congress on Your Corner events in Waterbury and the Farmington Valley, constituents come up to me and ask, what are you in Congress doing to help our families with the heroin epidemic? The families in Connecticut and across this country who are losing loved ones to drug addiction cannot afford for us to wait. We need to act now. Recovering from addiction is possible, but it is hard. So much of our effort to combat drug addiction is focused on helping folks get the treatment they need. And that is important, but it is not enough to treat the crisis. We must help people from getting addicted in the first place. And our bipartisan amendment does just that by directing the Interagency Task Force to establish guidelines that help prescribers more effectively and safely manage their patients' pain, and that strengthens consumer education about opioid addiction. Our amendment takes an important step towards preventing drug addiction. Those who prescribe narcotics would benefit from an increased education about the dangers of addiction and ways in which they can help minimize the risks associated with prescribing narcotics. Those hardest hit by this epidemic would benefit from having access to educational materials in our schools, community centers, and from local law enforcement that helps warn people about the dangers of opioid use and possible addiction. And I'm very encouraged that the House and Senate are taking action to address this public health crisis. And I'll continue doing everything within my power to make addiction prevention a priority. Opioid and heroin addiction have already taken so many young lives and needlessly torn apart so many families. We can't wait for more lives to be destroyed before we take action. So let's work together today to prevent our children, our students, our patients, our neighbors, our families, and our friends from becoming victims of this terrible public health crisis. Let's work together today to stop drug addiction before it begins. Thank you, and I yield back. I reserve the